Hello friends, welcome to the basic arthroscopy module. This program is developed in collaboration of MedVidya with Delhi Institute of Trauma and Orthopedics, which is situated at Sun Permanent Hospital, Delhi. I am Dr. Shekhar Srivastav. I am a senior consultant in arthroscopy and sports medicine at DITO, Delhi Institute of Trauma and Orthopedics. Now, this program is designed to give you an idea about the development of arthroscopy, the basic technique of arthroscopy, the diagnostic methods, and how to do knee and shoulder arthroscopy. Now, arthroscopy is one of the fastest growing field in the field of orthopedics. And apart from arthroplasty, I think this is a subject which generates most amount of interest in persons who are just graduating from the medical colleges. Even the senior ones who are not into arthroscopy are nowadays keen to learn arthroscopy. Let's go to the history. Now, the orthopedic surgery, as we all know, mostly consists of fracture treatment, deformity correction, joint replacements, soft tissue procedures, and spine surgeries, tumor surgeries. Now, the common thing among all these surgeries is that they are the open surgeries. And what we learn in our PG or in our fellowships is how to handle the soft tissues, how to handle the bone to get the desired result. Now, arthroscopy involves development of a totally different kind of skill sets. Now, in arthroscopic surgery, we are working through keyhole incisions, and so it requires person to develop the technique of triangulation. That means we are working at some other place and while we are looking at some other place. So this is the basic principle of triangulation, and that requires some sort of practice to develop. So that's why it's very different to the standard orthopedic surgeries which we learn during our fellowship or during our post-graduation studies. Now, the arthroscopy was first developed or first described by a Japanese surgeon, Takagi, and he used to perform arthroscopy in cadavers. But on live patients, the arthroscopy was first performed by his disciple, Dr. Watanabe, and he was the first surgeon to perform arthroscopy in a live patient. So the first surgery performed was removal of xanthomatous tumor, and he also performed meniscectomy. Now, in those days, the arthroscopy was very difficult to perform because there were no monitors. So people used to look through the scope inside the joint, and it was similar to riding a horse, holding a telescope in your hand. So you are not in total control of anything. So things really started developing with the development. Secondly, the problem was that in those days, the illumination was done by bulbs which were present at the tip of the scope. So it was a very difficult situation because sometimes these bulbs, they used to get burst inside the joint, and they also used to cause heat inside the joint, which used to damage the structures inside the joint. So that things really started to look up somewhere in 1970s with the development of cold light and also development of monitors. So now when you can perform surgeries looking at the monitors, your hands were free to perform the different techniques and different procedures. So that's how the development of knee arthroscopy, it really took off somewhere in around 1970s and 1980s. By early 1990s, surgeons were convinced that by arthroscopy, some things can be especially the intra-articular problems of the knee joint or the shoulder joint, can be performed in a much more accurate way than by open technique. Why? Because when you perform an arthroscopy, then you are looking at a very magnified image, which you can't see even through your naked eyes. Secondly, you can go around the corners, you can reach the back of the knee, and you can see structures which were normally not visible with the naked eyes. So it started gaining popularities for management of problems of the knee joint like the meniscal injuries, the ligament injuries. So all these intra-articular problems, they started to be managed with the help of arthroscope. The advantages of arthroscopy are many. The most important is that there is less soft tissue trauma. So this is how much the incision requires if you want to do an open ligament reconstruction. And that's how you can do it by arthroscope. So, and secondly, if you see the images through the arthroscope, so you can reach the different corner of the joint even through small spaces, and you can even look at structures which are behind the joint. You can look through small tears because you're getting a magnified views, and with special instruments you can work much more accurately. So the advantages of an arthroscope are: first, it gives a very small incision. As the incision is less, the soft tissue damage is less, so the pain is also less. The morbidity is much less than that of open surgery. You are looking at a very magnified image, sometimes 4 to 5 times the actual size. So your accuracy increases a lot. And as the soft tissue damage is less, you are doing an accurate surgery, so the return of function is also quite good. And last but not the least is the cosmesis. Now, especially in developing countries, it does matter a lot if you tell them that